the data is incorrect and there's not enough of it is one of the challenges. And then I started to question, like these apps are coming up because of this issue of like, there's nothing tailored towards different, stages of a woman's life, whether that's the fertility side of it, which was the first area that's really started to see this traction. And then I think in the last 3 days, I've seen a number of companies focused on menopause, which is another one where in this opinion piece, the doctor is saying, I asked a bunch of residents whether they had any patients in menopause, and they all said no. And it's like, that's not actually possible given the demographics of the patients that you're caring for.
Sheer numbers does not support your statement.
Sheer numbers do not support your statement. So the point I wanted to make was, well, first of all, there's still this sort of condescending, like, is this an opportunity? Yes, it's an opportunity. I think it's an opportunity not just for technology that is specifically aimed at women's health, but it's an opportunity for the EHRs, for example, to think about like, how are we collecting data on women's health? It's absolutely an opportunity for clinical trials to make sure that they are representing a diverse population. So there's also, there are other diversity issues in clinical trials as well. But it did take me back to this book, which I think when you read this book, or if you read this book, you would see the answer to these questions is yes. Like, we're missing a ton of data that could improve health. It could improve all kinds of products. And so one of the things I was remembering from the book was crash test dummies were tested on the average male, and medical textbooks were based on the average male. And so it's like, we could be doing so like low-hanging fruit from so much of a better job of both collecting the data and caring for diverse populations.